Welcome to GastroVision. I am Dr. Kazi and I am here to provide clear and concise educational content on endoscopic ultrasound. Today, we move to lesson 3 in our series on EUS approaches, where we will be focusing on transduodenal bulb approach in diagnostic endoscopic ultrasound. Before we begin, let me briefly revisit an important framework I have introduced earlier. The division of EUS transducer into 5 directional zones based on orientation of ultrasound beam emission. First is tip beam, that is emitted from the distal end of the transducer. Shaft beam emitted from the proximal end of transducer. Right beam from the right side of the transducer. Left beam from the left side. And central beam from the central axis of the transducer. This classification simplifies the understanding and interpretation of anatomical structures on the EUS screen. Tip beam structures appear on the left side of the EUS image. Shaft beam structures appear on the right side. Right beam structures displayed on the right side of the screen. Left beam structures appear on the left side and central beam are visualized in the central portion of the image. It is also essential to remember that structures displayed in the upper part of EUS image are anatomically closer to the transducer, while as those in the lower part of the screen are farther away. Let's start this approach. After you insert the scope into the duodenal bulb to image the portal vein, you will look for portal vein on the left side of your screen. Because once your transducer is in the duodenal bulb, the tip end of transducer is superiorly and shaft end inferiorly. You can see it in the image here. This is one of the reasons while I was naming different parts of transducer, I had used tip beam and shaft beam instead of superior and inferior beams. Because in the duodenal bulb, tip beam is superiorly and shaft beam is inferiorly, which is not the case while the scope was in the stomach. This would have created confusion. Coming back to the approach, my transducer in the duodenal bulb is facing posteriorly and leftwards. In this position, main portal vein will be in the field of tip beam. That's why you should search for it on the left side of your screen. If you notice here, tip beam traverses through the portal vein to the pancreatic body. That's why you can also visualize pancreatic body on the left side of the screen. But it will be farther from the probe, that is in the inferior part of the image. You can also see pancreatic head in the field of shaft beam. That's why you can appreciate pancreatic head on the right side of the image. At this point here, if you do slight lateral maneuver, you can appreciate anechoic tubular structure on the right side of EUS image within the pancreatic head. This structure is main pancreatic duct. If identification of the portal vein is difficult, first identify the intrahepatic portal vein and follow it towards the extrahepatic side. Again, knowing the position of your transducer is important. The transducer is upside down, that is distal end above and proximal end below, and it is not totally vertical but slanting, as you can see it in the image here. Tip beam is slightly on the right and shaft beam on the left. That's why if you do clockwise rotation at this point, structures at lower level relative to the transducer will start appearing on the screen. That means portal confluence will be in my central beam range. Portal vein will be in the view of tip beam. That's why it will continue to be on the left side of the image. Superior mesenteric artery will be partially in the view of shaft beam and it will be rightwards in the image. Splenic vein will be in the field range of central beam and it will be displayed in the center as a branch. You will keep on rotating your scope clockwise. After confluence disappears, you can see tubular anechoic structure within pancreatic shadow. This structure is main pancreatic duct. At this point, you will do slight anticlockwise rotation to trace main pancreatic duct. The region where the main pancreatic duct crosses superior mesenteric vein and portal vein is the neck of pancreas. After examining the neck area, you will again start rotating your scope clockwise. In addition to vascular structures that you have identified already, you will look for small tubular anechoic structure which is just close to the transducer. This structure is common bile duct. Many a times it may be compressed by the transducer and it will be difficult to locate it. At that time you need to release big knob by moving it away from you slightly. Now keep turning the scope clockwise and gently advance the scope while slightly deflecting it. The head of the pancreas and the area of the major papilla will be imaged on the right side of the screen. You can also see two anechoic oval structures on the screen. They are bile duct and pancreatic duct. Remember, in the stomach station, acoustic beams were traversing pancreas from anterior to posterior. The structures closer to the probe were actually anteriorly placed. That's why the pancreatic duct was displayed closer to the probe, that is in the superior field of the image. But here, the direction of acoustic beam is from superior to inferior. So the structures closer to the probe will be placed superiorly. That's why here in this case, the oval anechoic structure closer to the probe is bile duct instead of pancreatic duct. At this point, it is important to know the position of your transducer. Your transducer is placed more or less in a horizontal plane, with probe facing downwards and posteriorly. That is why in your range of view is distal part of bile duct and pancreatic head region. Now from this position, if I do slight anticlockwise rotation, the transducer will start now facing posteriorly. Remember, the initial position was posteriorly downwards. If you keep on doing anticlockwise rotation, your transducer will now face the posteriorly superior direction. Let me repeat it. Initially, probe was facing posteriorly downwards. Distal part of the bile duct and pancreatic head was in my field of view. Now on anticlockwise rotation, my field of view moves from posterior downwards to posterior upwards. That is why I am actually tracing bile duct from distal to proximal part. This is the best view to visualize extrahepatic bile duct from the major papillary area to hepatic hilum. Besides bile duct, you can also see long tubular anechoic structure running parallel to it, and this structure is main portal vein. You can see main portal vein will be farther from the probe while you are visualizing it from the duodenum. In the duodenum, immediate closer structure will be bile duct. If you remember, in gastric station, main portal vein was closer to probe than bile duct. While tracing the common bile duct from major papillary area to hepatic hilum, you can appreciate another anechoic structure with a thick wall in hilar area, and this is right hepatic artery. This artery you will find between bile duct and main portal vein. Now proceed to observe the hepatic hilum while following the portal vein and bile duct by anticlockwise rotation with slight deflection. In the hilar region, you can see main portal vein dividing into right portal vein and left portal vein. Right branch will be closer to the probe and left branch farther from it. At this point, you should be able to identify the junction where the bile duct and cystic duct join. From there, you can trace the cystic duct carefully and observe gallbladder from the neck to the fundus. If visualization of cystic duct is difficult, the gallbladder can be visualized or imaged if you turn the scope counterclockwise. That is all for transduodenal approach. Thank you and see you in the next video.